Patients who present to my office with knee pain who are diagnosed with osteoarthritis of the knee are under the misconception that entails immediate surgery. First off, I always like to educate my patients on what osteoarthritis is. A lot of them are under the misconception that it's a cumulative process, because many of them will often ask me if I can go in and scrape out the arthritis. The best analogy that I can explain to my patients is that arthritis is a subtractive process, where the cartilage actually flakes off the bone, much in the same way that paint peels off your house. So it's not like barnacles building up on the side of the boat where I can go in and scrape them off, but actually the paint is peeled off the house, so I can't put it back on. So once the cartilage is peeled off, there's exposed bone, which has nerve endings, which means bone on bone, which results in increasing pain. Now, once that diagnosis has been established, again, we don't jump in on surgery. There are many conservative options for knee arthritis. Typically, that may involve anti-inflammatories, activity modification, physical therapy. As far as the anti-inflammatories, those are the Aleve, the Advils, even Tylenol in some cases to alleviate the pain. If those don't work, then we kind of segue into injections. And the injections may involve corticosteroid injections, like cortisone, of which you're limited to 3 in a year. And if those don't work, we often have synthetic hyaluronic acid, rooster comb injections, gel shots. People have different names for them. I refer to it as WD-40 for the knee. And typically what that involves is a series of 3 injections administered a week apart to inject a lubricant between the 2 arthritic bone surfaces. And typically that's done in the office. It takes only a few moments to do it, and it should last for approximately 6 months, after which it can be repeated. Now, if all conservative management has failed, including anti-inflammatories, physical therapy, injections, then and only then do we discuss surgical options in the form of knee replacement surgery.